Hello, my name is Encarnacion. Today we're going to talk about dural folds and venous sinus. The meninges are the membrane covering the brain and the spinal cord. The meninges we need to divide in three types, three membranes. The Dura Mater, the arachnoid, and the pia mater. This division is from outside to inside. Outside to inside. Between the Dura Mater and the periosteum, this is the bone here, this is the bone. And we have the periosteum here, and this is the Dura Mater, okay? So between these two membranes, we have the epidural space. This is important because we can have the epidural hematoma in some trauma cases. Later, more deep, we have the arachnoid. Here we have the arachnoid, and between the arachnoid and the Dura Mater, this is Dura Mater here, and arachnoid, we have the subdural space. The cerebral spinal fluid, it's there, and you see all this here, these membranes, like when the spider made the arachnoid. So we have these membranes here, okay? So subdural space. In some clinical cases, we can have also here some hematoma, subdural hematoma. And between the arachnoid and the pia mater, the pia mater is the inner one. Pia mater is the inner one, is very attached to the brain tissues. And between the arachnoid and pia mater, we have the subarachnoid space. Okay, subarachnoid space. Subarachnoid space between dura and arachnoid, we have the subdural space, and between dura and between periosteum, we have the epidural space. So we see here the Dura Mater is the strongest one, okay? And it's gonna have some folds, like the falx cerebri, falx cerebelli, Tentorium cerebelli, and also the diaphragma cellae or diaphragma cella. The arachnoid, as we say, like the spidery, this when the spiders make the web. Holds also the blood vessels are in this. We're gonna find a lot of the blood vessels in there, okay? And the pia mater, the delicate motor, is very attached to the brain. Now we're gonna talk about the Dura Mater. The falx cerebri is a prolongation of the Dura Mater. It's vertical, medial, and anteroposterior. It's located in the longitudinal fissure between both of hemispheres. It's triangular and it's incurved as a shape of side. This is a side. Okay, you understand the concept. This is the side. It have two surfaces. Both of these two surfaces are located between the inner surface of the hemisphere. Okay, this is we are seeing an anterior cut, and it's a coronal cut of the hemisphere. And between both hemispheres, you're gonna have the falx cerebri. It have a base here. This base is inclined inferior and posterior, and continues in the line junction of the falx cerebelli. And you're gonna find between this connection of the falx cerebelli and falx cerebri, we're gonna find the sinus rectus. Okay, here we're gonna find the sinus rectus there, okay, between this line of junction. It have a vertex anterior here, have a vertex, and this vertex is gonna be attached to the crista galli. Crista galli, we remember, is a vertical part or vertical osseous process of the ethmoid bone. It have a superior boulder, you see here. All this is the superior boulder. It's convex, and this superior boulder, all this trajectory, have the fall for the superior sagittal sinus. The inferior boulder, we're gonna find here. The inferior boulder here is concavate, and it's all around the middle line, and also it's gonna have the fold for the inferior sagittal sinus here. Now we're gonna talk about the Tentorium cerebelli, or just Tentorium. The Tentorium have the shape of a C. You can see here, it's a C. No, in vertical, it's a C. In horizontal, okay, in transverse way. It have two surfaces, one superior and one inferior. The superior surface laterally is related with the occipital lobe of the cerebrum. Here you see here, this part is here, okay, and the inferior surface is related with the superior part or superior surface of the cerebellum hemisphere. But in the middle part here, in the middle part of the superior surface, is related to the falx cerebri, and inferior with the falx cerebelli. You can see here it have two circumference, one posterior or major, and one here minor circumference. The major circumference or posterior border is extend all over from the posterior clinoid here, go through the superior border of the petrous part of the temporal bone, later go through the lips of the sulcus of the transverse sinus, attach from in the middle part, attached to the internal occipital protuberance, go over to the oppositive posterior clinoid process. The anterior border here of the minor circumference, as you can see, is concave, and its limit posteriorly and anteriorly with the clivus, gonna limitate both the clivus here and the anterior border of the tentorium is gonna limitate the tentorium notch here, and in this part you're gonna have all over here the brainstem. So now we're gonna talk about the falx cerebelli. This is a vertical lamina. It's located between the both cerebellum hemisphere. It has a base, is superior, and is attached to the tentorium here. Have a vertex. This vertex is bifurcated in two parts by the occipital sinus. The posterior border is attached to the occipital internal crest, and the anterior border is free and is related with the vermis cerebellum. You're gonna see it here, okay, or inferiorly. You can see here the falx cerebellum. Here. This is the cerebellum hemisphere. Okay. Okay. So in the end, we're going to talk about the diaphragma celli. The diaphragma celli is over here. It's a dural fold who cover all over the sella turcica. It's extend transverse, extend all over and cover all over the pituitary gland, except in here in the center, in the pituitary stalk. There's no cover from the diaphragma celli. This plate extends all over horizontal, and it's attached posteriorly to the superior border of the sella turcica and anterior to the posterior lip of the optical canal. So as you can see here, falx cerebri, tentorium. We're gonna see here more down, we're gonna see the falx cerebellum, and here we have sella diaphragma celli. Superior border of the falx cerebri, inferior border, the base, vertex. As you remember, as we spoke here in the superior border of the falx cerebri, you're gonna be here attached to the sinus. So superior sagittal sinus have the two lateral walls here, attached here in the vertex of these two lateral walls. This is superior sagittal sinus. Okay, we're gonna talk about the sinus now.